I am Lori Murray, President of the Committee for Economic Development of the Conference Board. No one could have predicted this confluence of events just a few months ago. Beginning with the COVID-19 pandemic, the ensuing economic crisis, and then the killing of George Floyd, followed by the seismic street protests driving a sea change in public consciousness. CEOs across the corporate landscape have added their voices to this discussion and are determined to use their influence to make lasting change. For over 100 years, the Conference Board has helped the world's leading companies and society at large navigate crises and develop reasoned solutions in our country's interests. Founded amid the labor unrest of 1916, the Conference Board led the adoption of workplace safety reforms, compulsory health insurance, and the 8-hour workday. We were at the forefront of the conversations regarding opening the workplace to women, people of color, and people with disabilities. Our policy center, the Committee for Economic Development, which I lead, helped shape the Marshall Plan that rebuilt Europe after World War II, as well as the Jobs Act of 1946, which set forth significant workplace reforms. That tradition continues today with our efforts to shape public policy that impacts our workplaces, communities, and government. Given recent events, the Conference Board is launching a series of CEO forums to foster action called Building a More Civil and Just Society. The CEO Forum series will feature CEOs from across America in industries of all different sectors, focused on actionable insights to address our societal challenges. Today, we are talking to Dr. Marc Gorelick, and we will be discussing building a healthcare system that is more accessible to all Americans. Dr. Gorelick is the CEO of Children's Minnesota, one of the largest freestanding pediatric health systems in the US. He joined Children's in March 2017 as President and Chief Operating Officer. He is deeply committed to identifying sustainable ways Children's can continue to deliver exceptional care in an evolving healthcare environment. Dr. Gorelick previously served as Executive Vice President and COO of Children's Hospital of Wisconsin in Milwaukee. A pediatric emergency medicine physician by training, his prior experience includes faculty positions at Medical College of Wisconsin and the University of Pennsylvania, and clinical and leadership roles at Children's Hospital of Philadelphia. His education includes an AB degree in history from Princeton University, an MD degree from Duke University, and a Master's of Science in Clinical Epidemiology from the University of Pennsylvania. Dr. Gorelick has been trained in pediatrics at Children's National Medical Center and in pediatric emergency medicine at Children's Hospital of Philadelphia. Today, we are going to, as I mentioned, discuss making a healthcare system much more accessible to all Americans. But Marc, I first would like to open the discussion more broadly. You're based in St. Paul, Minnesota, which is the epicenter of the recent tragedy. And I was hoping you could share with us, given the events that followed the killing of George Floyd, how you would characterize first what is happening in terms of the social state in Minneapolis, St. Paul, as well as more broadly across the nation from your perspective.
Yeah, thanks, Lori. You know, in some ways, I think it's very apt that the current awareness of just the state of racial division in our country was made aware by an event that happened here in Minneapolis, which George Floyd's killing was just 12 blocks from our Minneapolis hospital. We're the Twin Cities, and for those of you who are not familiar, we're called that because we have two large, similarly sized metro, Minneapolis and St. Paul, that are directly congruent with each other. They're not identical twins. There's a sort of a usually somewhat friendly rivalry between them. But the level of division between Minneapolis and St. Paul that we like to sort of joke about is nothing compared to the level of division between white metro and people of color metro. And in a country where there are staggering levels of racial disparity in all types of indicators of well-being, economic, educational, health-related, Minnesota stands out as having among the biggest disparities between whites and Minnesotans of color. So the idea that somehow this awareness has been raised by an event that happened here, I think is apt. It's become almost a cliche to say that our nation is more divided than ever. And I think from a white person's perspective, that may be true, at least if you don't go back too far, but say in the last 30, 40 years. I think from a Black person would say, what are you talking about? These divisions have been here all along. You have either not seen them or chosen not to see them. And George Floyd's killing was nothing unique, unfortunately. Just even here in our own metro area, this is the most recent of a series of similar events. But what was different about it was captured on video in a way that made it absolutely impossible for anybody to claim ignorance any longer. And so what we've seen is a level of disparity and inequity, again, across the board, not just here in Minnesota, but across the country, that is really striking. The positive side of it, though, I would say, is it is now impossible to ignore. And I think if you look at the protests that happened here in Minnesota, that happened around the country, there are a lot more people that look like me that were at those protests, including me. You hear business leaders talking about racial disparities and inequities in ways they've never talked about before. And so I'm encouraged that the dialogue has finally shifted, and it is not limited to one group. It is a universal conversation that is now happening, and there's a real commitment, I think, emerging from leaders, business leaders, government leaders, others, to not just talk about it, but actually do something about it.
So the issues of racism and inequity are not new, as you were just pointing out, and it sounds like you think this is a different time for America. Civil unrest is not new, but is this different? It sounds like you think it is, that lasting positive change might be possible.
Yeah, I'll give you an example. We have something here, the Minnesota Business Partnership. It's about 70 or so of the largest companies in Minnesota, and we have a large number of Fortune 500 companies. So we're talking about big organizations. Shortly after George Floyd's killing, we had a conference call, and I heard CEOs of, 9-figure corporations fluently talking about things like using phrases like systemic racism, white supremacy, talking about the need for police reform, talking about the need for economic reform in ways that I've never heard those people talk about before. And those leaders not only talking about it, but making commitments for their organization and for the community at large to actually make some meaningful changes. So I do think it is a different time. Again, it's a level of awareness that some of us have just not had up until recently.
That's really interesting. COVID-19, to get to the actual healthcare piece of this, it's shown a spotlight on these inequities in our society. And most importantly, we're seeing the disproportionate and devastating impact of COVID-19 on Americans of color. Can you tell us what you've been seeing at Children's Minnesota, particularly among children, as well as within your workforce of frontline workers in this crisis? How are you seeing the disparity playing out?
Yeah, so certainly in Minnesota and at Children's, what we're seeing mirrors what we see in the rest of the country. People of color, including children of color, Blacks, Latinos, Asians, are more likely to get COVID-19 and are more likely to be severely affected by it. As a lot of people are probably aware, children in general are less affected by COVID-19, especially young children, less likely to get the disease, less likely to be sick from it. But within our own population, we are seeing the same racial disparities. So our overall patient population is about 45% people of color for children in Minnesota. Almost 70% of our COVID-19 cases are Black, Latino, and Asian children.
Oh my goodness.
And so, COVID-19 is just one example of a health disparity, and itself is probably the result of other health disparities. And you think about why it is that people of color are more likely to be affected. Some of it is around the social inequities. So People of color are more likely to have jobs where they can't socially isolate. They're going to be in jobs that are going to require direct personal contact as opposed to being able to work remotely, as many of us are now doing. And they're more likely to have underlying health conditions that predispose them to more severe disease because of many of the underlying health disparities that we've had for centuries in this country. So it's, COVID-19 is it's the canary in the coal mine almost. It's just an indicator of so much more health disparity that we have in our society at large.
So how are you addressing that disproportionate impact? And also, what lessons do you think we can learn in terms of improving our healthcare system for the underserved and at-risk populations?
We have made a commitment to equity and diversity and inclusion a core commitment here at Children's for really the last 3 years. The Institute of Medicine back in the 90s issued a report about healthcare quality, and they defined 6 domains of quality. When we think about healthcare quality, we often think about outcomes. That's one of them. Think about safety. There's been a lot of talk about patient safety in the last couple of decades. We talk about timeliness, being patient-centered. But one of those domains of equity, one of those core domains of quality, rather, is equity. And it's the domain of quality that often gets forgotten. And we've really elevated that here. So when we measure our quality information, we not only measure outcomes and safety and patient-centeredness, we are also measuring equity. We've created an equity dashboard, and we share that with our quality committee of our board and with our full board every month. And so I think, one way of addressing, globally, your question about how do we make the health system more equitable, well, the first thing you have to do is recognize that equity is a core component of quality, and you have to commit to treating it the same way you treat other domains of quality. So most hospitals and health systems have taken a strong stand on promoting patient safety, which is fantastic. We need to take those lessons we learned about how are we making patients safe and how do we make our healthcare more equitable. And that's a large part of what we've done. So it's a recognition, it's measurement. You can't improve what you don't measure. So we have this dashboard where we show on a variety of our health outcome measures and process measures how we do with our white patients, how we're doing with our Black patients. And we look at that gap and it stares you right in the face, and then we see how we progress each month. And we've started to build in now goals towards not just measuring it, not just admiring the problem, but actually doing something about it. So you have to recognize it, you have to measure it, and then you have to implement change and hold accountability. We now have all of the leaders in our organization have part of their compensation tied to whether we close the gap and whether children with asthma in our system have their asthma under good control. There's a concrete example. 91% of our white kids have asthma that's under good control. It's only 76% of our Black kids. We've implemented a number of measures in our clinics to try to improve that. And at the end of the day, we're holding everybody accountable for achieving that goal.
So how do you get support to take those lessons, the lessons that you're implementing at Children's Minnesota, and apply them more broadly? Who should be involved in that? How do you get that done?
Within a health system, there has to be universal buy-in, right? I mean, you look at any one of these problems, whether it's asthma control, whether it's people who can make it to their appointments, whether it's kids getting immunized, all of those disparities are multifactorial. There are the clinicians in the clinic, there are the people scheduling the appointments, there are people on the back end handling the finances. So we need to help everybody understand how they contribute to that. That's within our own system. We also need to get other systems doing this. One of the lessons we learned about patient safety is you're much better off working with others. We all have this problem. As I said, we have some of the worst disparities here in Minnesota, but it's not like any state is doing great. And we have a collaborative among children's hospitals, for example, and there are other similar collaboratives in adult healthcare on patient safety, where we work together to develop best practices, share information. We need to start building those collaboratives around equity. We need to start, each of us is starting to recognize our own problems. That's where we were with safety back in the 90s. Now we need to come together and say, how do we do that? An example of how we're doing that outside of healthcare is one of the first things that I did when I became CEO was signed on to something called the CEO Action Pledge on Diversity and Inclusion. This is a national collaborative. It now includes over 1,000 CEOs across the country. It started in 2017, and it was started by some of the large finance firms in New York, PwC, EY, et cetera. And the goal was to get CEOs, publicly traded companies, privately held companies, not-for-profit organizations like ours, across all sectors, to commit to doing something around diversity and inclusion. And we pledge to take certain actions, but then we also collaborate. So we share best practices and, frankly, worst practices. What did you do that worked? What didn't work? So that's something we're doing as leaders on equity, diversity, and inclusion in general. And within healthcare, we can do the same thing. We've done it with other areas of quality. We can do the same thing with regard to equity and disparities.
So is there anything that you think should be front and center on the public policy side to support what you're doing, or to broaden what you're doing, or to require what you're doing?
Yeah, I think there's a few things. First is when we talk about the disproportionate impact of COVID-19 on Black, Indigenous, and people of color, there's the direct impact, it's the higher rates of disease, the mortality, et cetera. The indirect impact, which we're not even starting to measure yet, but particularly for kids, is dramatic. Kids have been out of school, parents are out of work. When we think about the impact of the COVID-19 pandemic and the economic distress on what we commonly refer to as the social determinants of health is going to be huge. As a healthcare system, we've started to recognize the importance of those social determinants of health. That needs to be built in more. Our provider systems and our payer systems need to recognize that if you want people to be healthy and you want to close the health disparities in things like infant mortality, asthma, whatever it is, you need to address things like food, shelter, education, employment, et cetera. Our health system doesn't do that. We're starting to, but we need to incorporate that into our payer systems and our provider systems. So we have a program where we, in our clinics, address social determinants of health. We have to raise philanthropic funds for that. We need to move our system to one where, the payers are not just paying for medical care, but they're paying for health care, which includes those social determinants. So that's one. The second is, I think one of the things that has become pretty clear from this pandemic is the level of public investment in public health, and in that social spending is really far too low, especially compared to other countries. So I think beefing up our public health system so we can get a better line of sight on not just acute illnesses like COVID-19, but the chronic illnesses. How are we monitoring those? How are we identifying through our public health monitoring systems those disparities and inequities so that we can address them?
Yeah, it's really distressing when you see the types of triggers for a worst case of COVID-19 happen to be all of the health conditions that the underprivileged seem to have at very high levels. It's particularly distressing, and it's really reassuring to hear what you're trying to do and what you think we ought to be doing even further in those areas. Marc, I have to, listening to you and listening to your leadership, your passion, your focus on this, and also you mentioned that you were actually out in the streets with the protests over the killing of George Floyd and the inequities that and systemic racism that we're seeing. And I was just wondering, in terms of you, and we've also watched the tremendous heroism in this crisis of the frontline workers in the healthcare industry, coming to work every day, dealing with COVID-19 patients, whether or not they had the protection that they needed, really dedicated to fulfilling the mission of being in the healthcare sector and being a healthcare worker. What are some of the driving motivations that have, the definitive moments in your life that actually helped you evolve to the passion and commitment that you have in this area?
I early on in my training, is when I was at Children's National Medical Center. I took care of a little girl in the emergency department. Back then, when we had to do something that might be painful, we didn't do a lot of sedation like we do now. So we would kind of hold kids down and just get them through it. We had a little girl, about 4 or 5 years old, black girl, had something in her ear I needed to get out. So nurses were holding her down. And of course, being 4 or 5 years old, she's struggling and she's trying to get away and she's yelling, "Get off me, get off me." And finally she yelled, "Get off me, you white people." And, initially, of course, we thought this was a funny thing for 4 or 5-year-olds. But I thought, what has this little girl's experience been that the most terrifying thing that she can imagine is being held down by a bunch of white doctors and nurses? And it really opened my eyes to the level of disparity that we have and the way that impacts health. If this little girl is so terrified of me, and I don't think I'm a particularly terrifying looking individual, if she's so terrified of me, what does that do for her ability to come in and get health care? What does that mean for her family's ability to manage her health? And so it really brought home for me this connection between racial disparities and the health of kids, which is what I'm passionate about. I went into pediatric healthcare because I want kids to be healthy. And we're not going to make kids healthy unless we make the least healthy ones healthy. So we've got to close those gaps because we're not going to raise the bar unless we raise the bottom. And so it's really those, an emotional connection as well as just intellectually looking at the data and saying, if I want my level of asthma control to go up, I got to help the kids who are at the bottom the most. That's what's going to bring the population health up. That's going to make kids healthier.
Well, Marc, thank you so much for joining us in this series of CEO forums on these really critical issues of how to build a more civil and just society. And thank you for everything you are doing and everyone at Children's Minnesota are doing in terms of dealing with these really critical issues, trying to really change and reform our healthcare system and our society. And as I mentioned, if there was ever a time when we have a passionate thank you to the healthcare community and everyone involved, if we haven't recognized what you all have been doing over the years, COVID-19 has shown a spotlight on your heroism and your leadership. So thank you very much. Thank you for joining this series, and thank you for helping to shed a spotlight on some answers and some direction forward.
Well, thank you, Lori, and thanks to the CED for making this forum available to raise awareness even further.
Okay, take care.
Bye.
Thank you.